And the third panelist, very excited to introduce Dr. Pamina Gorbach, who is professor in the departments of Epi in the School of Public Health, but also in the Division of Infectious Diseases at the Geffen School of Medicine. Welcome, Dr. Gorbach. Yeah, that's right.
Okay, I am the only card-carrying epidemiologist here today, so I'm going to have to show you some slides about infectious diseases. So I'm going to talk about not just this pandemic, but I'm going to talk about multiple pandemics. And I'm going to remind you that the topic I called was syndemics, because we have had the confluence of multiple epidemics of infectious diseases. So let me start with HIV, which is the first pandemic I worked on, but not necessarily the first pandemic there is. Just to remind everyone what it is, HIV is human immunodeficiency virus. And there is still no effective cure. Once people get HIV, they have it for life. There is very effective treatment. So now with good care, people now are what we call untransmissible. They can be if they become undetectable, which is a real game changer. I just want to remind people how this infectious disease is transmitted: sexual contact, sharing needles, a mother to body during pregnancy, birth, or childbirth, not by air or water, saliva, sweat, or tears, insects or pets, or sharing toilets. But where are we with HIV? I told you I'm going to go fast here, 7 minutes, cover 3 pandemics. Globally, we have 38 million people living with HIV, 38 million people. This is 2021, where you have the latest stats. 1.5 million people newly infected with HIV in 2021. So this is still an ongoing pandemic. And 650,000 people who died from AIDS-related illnesses. But we have 28.7 million people accessing antiretroviral therapy. Just to put this in context, 84 million people have been infected with HIV since the start of the epidemic, and 40 million people have died. But this is a lesson of treatment and how treatment has saved lives. And so what we can see is the curve here of how people were dying until we introduced medication. It was introduced in 1995 when I got my degree, which was a real game changer, but it wasn't until really 2005 we saw the curve come as the treatment became rolled out globally. Huge difference, and what would have happened if we hadn't had treatment is the red line. But we got a long way to go. This is not a pandemic that is over. We have not solved all the problems. This shows you where we are in the United States with HIV right now, and what's called the care continuum, which is that although most people, 87% living with HIV, are diagnosed, we still don't get them into care and treatment, and we only have about 57% who are virally suppressed at this point. So that's a lot of work we still have left to do. So what am I going to tell you? I'm going to tell you a little bit about the work that's being done here by me and my group. There are many other people here at UCLA who do incredible work on HIV, and I wish I had time in 7 minutes to acknowledge them, but I don't. So I'm going to talk about my work. So I work on, as I said in the top, bugs, drugs, bugs and drugs, and sex. I mostly focus on drugs right now, and I started doing work on mostly men who have sex with men here in Los Angeles. And there, our epidemic is really driven by methamphetamine use. I also do a lot of work, mostly recently, on cannabis and inflammation, and I have a couple new projects coming in, really exciting, looking at cannabis and HIV. Sex, bugs, and drugs. So I'm going to talk a little bit later on some of my current ongoing projects. But my main project is this cohort, which is a research platform that is now in its 14th year, which we call the M study. We have enrolled over 571 men. We have lost a lot of our guys during the pandemic, the COVID pandemic, but we're trying to get them back. But just so you can see the numbers here, we have a lot of substance use, and that is what we're looking at, is really the that's syndemic of substance use and HIV here. We have had about a 5% incidence rate, which is people that got newly infected, and 17, these are young men who have died while we've been following them. I just want to let you know we have a huge biorepository. So this is a research platform. It's not a study, which means we encourage a lot of other people to use our specimens and do research building off of them. And this is an example of just what we've covered and who else is funded to do this work. And we have over 26 active studies with this. but we've had doctoral dissertations and postdocs and also real careers launched from K Awards to now R01s from some investigators across campus with this. And I need to acknowledge our community partners could not have done this without the LGBT Center that has been a partner of mine for over 20 years and is the site for our people living with HIV. Also the Vine Street Clinic, which is the only UCLA outpatient research clinic that actually in 2006 I opened with my co-PI of this project, Steve Shoptaw, but he has taken it over and it is a really active research site out in Hollywood, and we see all of our people without HIV living there. Two really exciting projects that are starting up right now that I'm doing. One of them we're awaiting the money to hit us, but they made us start the work, is going to be a virtual cohort of over 1,000 people across the United States who are living with HIV but not suppressed. These are the people left behind or who are missed. And we're going to try to reach them virtually and follow them. And another one is looking at increasing our rigor and measurement of this synergy of substance use and HIV. There we have I have a new grant coming in with Dr. Monica Gandhi at UCSF, where we're going to be learning how to use hair to look at substance use and do rigorous assessments. So I'm going to talk quick about COVID-19 because there was the next pandemic. This is where we are with COVID-19 as of the latest dashboard. Looking at this globally, just remember how many cases we have had here, a lot, and where it is in the United States. So certainly we have gone through a journey with this pandemic. It is not over, but yes, we have low cases right now. I still wear my mask in these large settings. I thought I could avoid getting COVID. I got it. Even with the mask on all the time, it's going to hit us, but let's do our best to try to keep it at bay still. And looking at that syndemic of COVID and substance use, we actually put out a whole, with my colleagues, 21 papers in a special issue on the effects of COVID among people living with HIV and who use substances. And then I'm going to end with the latest pandemic, which is Mpox. And I can do this in a minute. Most cases have been among men, mostly among MSM globally and in the United States. The lowest vaccination rates. There is a vaccine for Mpox. We don't know how long it lasts for. We don't know how effective it is. We are doing a study to try to figure that out with Annie Remoyne. The lowest vaccination rates are among people of color. Most reported exposure settings are in party contacts. This is what the epidemic curve looked like for Mpox. We are nervous about this year and this summer, and so we'll see as the party season starts if we can get out there ahead of it. We're trying to get materials out to the Pride festivals and other activities going on. I've had over 30,000 cases in the United States and 42 deaths. This is the state counts. And again, our work, what are we doing here? Working with Dr. Annie Remoyne and Dr. Dave Talon in infectious diseases, or actually he's in the Department of Emergency. We've got a really exciting set of 4 projects coming in with CDC funding. We're looking at stored specimens that we had from our biorepository. We're looking at vaccine efficacy. We're looking at surveillance in 4 major emergency rooms, and we're looking at surveillance prospectively with sex workers. So, infectious disease represents syndemics. That's the story here. Who has the highest infection and mortality rates? People of color, people in less resource settings, people with other conditions such as substance use, and sexual and gender minorities. That is the story across these pandemics, with the exception of COVID that really was broad-reaching. Who is the last to receive or adopt prevention and treatment? And that is people of color, people in less resource settings, and people with other conditions such as substance use. So that is how our work needs to have a syndemic focus. And this is just to acknowledge the incredible core scientific team that I'm lucky to work at in my research center. And I couldn't do the work without them. Marjan Javanbach here is the co-director, and I really couldn't without her. And that's where we are.